everyone, today's unboxing is on homeopathic remedies for sprains and strains. So today's homeopathic remedy, now homeopathy, I should probably preface this. Homeopathy is a practice of healing and medicine that's been around for about 200 years. Even before then it was mentioned in older books, but Hahnemann came up with the practice and put into algorithms and texts, and it applied it, and it's been thought of as placebo in a lot of Western medicine or allopathic circles. In fact, I have to hold my tongue sometimes when I say that I'm going to give my patient homeopathy pellets or homeopathy gels or topicals, because it just goes down a road where my colleagues will probably not put too much into that kind of treatment. Although I have pediatricians I have a pediatrician that practices it all the time and actually gets very good results. Now you can go to a place like Whole Foods and see a whole setup with a whole bunch of things like this. These little tiny blue capsules that have sugar pellets in them. And there's a little bit of a ledger as far as a couple symptoms and the homeopathic medicine of choice. And I think it really takes more than that. That's kind of like having a cookbook for antibiotic remedies or antibiotic treatments or Western medicine prescriptions. And theoretically there is a sense of doing that in Western medicine cookbook. You have a diagnosis, you have the typical treatment, the typical coverage by insurance, so come up with a diagnosis, and goes straight to the end result. I think we've done that with medicine to facilitate getting patients in and out fast, but it takes that valuable time of interview and getting to know somebody out of the picture, out of the equation, and that's when you start to treat everybody as an average, and that's not wise because people fall above and below the average. So if you treat everybody that way, you might run a medical system quickly and efficiently, but you're not going to heal anybody up. So this is where we are now, right? So anyway, I like this, especially when it comes down to kids. And I have a kid who has a muscle strain. And we don't want to do too many different medicines with muscle strains because they'll probably get better. But if you're in sports medicine and you know that your time of healing has to be compressed to get through and participate and get the benefits of that sport, you want to speed up or facilitate things. Now, you don't want to be using anabolic steroids with kids, but by the same token, you don't want to be using too many prescription medicines with kids because they have to spend the majority of their day learning and interacting and being in class and paying attention. So side effects are heavy. So you have to be careful, and that's where I think homeopathic pellets come in handy. Now, I can't get into too much of the discussion on the theory of homeopathy, but again, if you look it up, it's going to be a little bit unusual, but it does work. So it doesn't work with all of my patients, but in the select few that I choose to use it with, it does help. So in the case of muscle strain, I chose Ruta. And Ruta, hopefully you can see that, at a strength of 30C, that's just the dilution strength. It's pretty diluted. And in theory, these sugar pellets, and I'll open up one now, these sugar pellets, so this is how you open this thing up. There's an end, and then there's a cap. And all you have to do is turn the cap a couple times, and usually what happens is the pellets come out. And those are the pellets. Hopefully you can see them. And they're mostly just sugar. You put them under the tongue. But the typical treatment, I can't put it back in. So the typical treatment is about 3 to 5 pellets, 3 to 4 times a day. Now if you have an acute strain, if I was to use this for an acute strain, I'd probably do, if you're an adult, 5 pellets 3 to 4 times a day. But for a young person, probably do 5 pellets tonight. See how they do. 5 pellets again tomorrow morning. See how they do. The thing is, there's really not a side effect with this, which is really a positive, right? And again, if you count on the theory of this thing, and I might as well just take a couple now, empty this thing out. So I actually have muscle strains, so I'm okay with it. So I'm taking this many here, if you can see that, and put them under the tongue, and they taste like sugar. So the concept of how it works after getting a lengthy discussion and questions and answers out of the way, they're under my tongue now, is that the true, not the cookbook, but the true choice by a homeopathic doctor has to be well thought out. And I just came up with this for my young guy who is injured. There's also, again, since there's no downside, I think it's helpful. Even if I was to give my young patient steroids, muscle relaxants, and anti-inflammatories, no interaction. This is what's cool too. In a pregnant mom or somebody that's on chemotherapy, no interactions. Somebody that's on mood medicines or neurological medicines, no interactions. So it's a nice added benefit. Kind of like acupuncture. Acupuncture will not interfere with anything short of pregnancy. You don't want too much energy floating. So it's a nice adjunct. I think it actually can be a standalone, as well as homeopathy by the right doctor. There's one doctor around here, Dr. Shepard. He's an MD, homeopathic doctor as well. I think he has really good results. So we're going to try this and see if my patient heals up fast. In addition to physical therapy, holding out from sports for the time being, having him work with icing and topicals, and I'll do a video on that soon. And we'll see. If it changes fast, great. I'll blame everything we did. If it doesn't change, I might get more aggressive with other medicines, maybe other homeopathics. This is arnica gel, or actually cream. And arnica cream works the same way, but it's topical. I think the oral work better. Usually the arnicas, or at least the creams or gels, there's a gel I have, let's just open this up. They work to do the same thing of by exposing the suffering individual to the like thing, or the homeopathic medicine. It should help the body speed up its healing. So that's the concept with homeopathy. Again, it's a little confusing. It's a little hard to believe if you're used to Western medicine, but the basic premise is like heals like. So there's plants. These things are made or derived from plants, animals, minerals. And if you take the essence of the plant, animal, or mineral, and you put it in water and you keep on diluting that bucket several thousand times, you'll end up with a pellet or with a gel or with a cream. And the theory is if the body that's suffering is exposed to the material that can cause the same symptoms, you might have the body speed up. So if you have somebody that has a muscle strain and there's pain with that and suffering and difficulty with sleep, there is a plant, a mineral, or an animal part that if given to a human will cause the same symptoms. So if you have itching and you take the extract of, I'm just going to make it short and sweet, take the extract of a poison ivy plant diluted to 1,000 or 1,000,000, by giving that pill to the patient, even though they don't get poison ivy, the itching will stop from whatever reason it's being initiated. So I just cut everything to the chase, and there's more to it. You'll have to read if you're interested, but that's the basic premise. And this is arnica. Arnica montava is also a homeopathic. It works to hopefully get through the skin and help with the healing process by that same concept I mentioned before. In acupuncture with UCLA, we use this stuff, Traumeel. It's out of Germany. And Traumeel, when we are doing a skin scraping or gua sha on the back, that's essentially when you really take care of a lot of acupuncture points on the back all at the same time. It's relaxing, but it causes a lot of bruising. And using this heals or turns around that black and blue mark to the back a lot faster than just letting the black and blue mark sit. So whether you buy into this concept or whether you just want to assume that it's placebo response, it doesn't matter. In fact, the U.S. pharmaceutical industry bets on the placebo response when they put new medicines out. There's a 30% placebo response that's worked into the formula when a new medicine is being developed. So if I was to just use a placebo response and I didn't do any harm and this doesn't cost that much, why not? but I really think there's more science to it than just a placebo response, and I think it works. So hopefully this gives you a little bit of an idea. Put your comments down below on which ailment you have and which homeopathic medicine and strength you've tried. Maybe we can get a conversation going. Otherwise, hopefully this helps. Again, I think you should really try to seek out somebody who's been either a diplomat or certified or trained in homeopathy. But if you don't want to go down that route, you can't find anybody, then ask your doctor. Sometimes there are advanced doctors or forward-thinking doctors that have touched on a little bit of homeopathic practice, and I think it'll be a great adjunct. So thanks for watching. Otherwise, subscribe to me down below for the next. I'm going to do a series of different tutorials and questions about sprains and strains coming up.